Hello everybody. If you can see me, if you can hear me, put plus. If you cannot see me, hear me, put minus. Let me know. We're gonna wait for some people to join. Always giving a couple times for the late ones, late arrivals, and we're going into the massage. Today is the last day to enroll in Glow in my 30-day transformational program. So if you've been thinking about it, today is the last day and the September enrollment will be closed. We can hear you. Great. Have your hands clean, have your moisturizer if needed nearby, napkin, some water, and we're going to start. Hello. I was the first one to join. Welcome. Can my 10 minutes tutorial be followed by someone who has a thin face? Yes, it can. Majority of those techniques are not lymphatic drainage wise, and by the way, anytime influencer offers you to put the cream, it's most likely lymphatic drainage. So if you do something on the side like for 10 minutes in oil, that's for the thin faces is not recommended, at least on a daily basis, because any supply, the drainage perceived supply, so you're gonna remove the fluid from your derma too fast. So my 10 minutes tutorial doesn't do that, and I try to be very mindful with the lymphatic drainages that I give you guys. Is it possible to feel pain? Oh, I don't understand. Probably it's possible to feel pain. Hello. Hi. Is your hair natural? Can nasolabial be softened at age 22? At any age it can be softened and smoothed out. Are you eating something? Uh-oh. Your age. Somebody tells them that my age. I'm pretty sure people will know. And we're going to start with some massage. Yesterday we were concentrating on our neck, on our jugular triangle, on our temporal bone, on our foramen for the jugular vein that comes from your temporal bone. And today we're going to go to the eyes. Eyes is a tricky area, guys, because it's the middle of your face, and not only it's just the middle of your face and surrounding lots of bones and lot of sutures, it's also extension of your nervous system, obviously. And of course our eyes can get puffy from the top, from the underneath. Our under eye doesn't have a lot of fat, that's why the color of your circulation will be seen very easily, right, like as known as dark circles. So obviously if you have a arterial blood full of oxygen, it's going to be red and pinkish and glowing, and if you have not as oxygenated blood, it's going to be darker. Some dark genetics circles. So if you see, if you look at your 5 years old and you already have dark circles, your goal is not to make them worse, but just accept them, because nothing from really like the way the bones, so the way the tissue is located, nothing can be changed dramatically. So I want you to have correct expectations at this point as well. And we're going to start 5 minutes. Everybody has a clean hands. When we treat lymphatic system, we are very superficial, we are barely touching. Think about feather, think about just moving your skin around, just introducing your touch to your receptors. please answer. Fatima, right now we are doing massage and I'm trying to, concentrate and give you a good plan. Let's do Q&A afterwards, right? I know it's a little bit chaos in the comment section, but let's do massage. And if you have a question about techniques, so I stay on point, right? So we starting with on top of your clavicle bone, just 10 little taps, moves. See how this area feels today, right? This area in, I don't want to say normal body because everybody is normal, but in the healthiest as we can be body. So this area is not puffy, this area is easy to palpate, this area is very close to your deep things as lungs and your pleural lungs and your deep front line. So this is a very important area. Vagus nerve goes there, carotid artery, a lot of things. So this, we want to make sure that nothing that like sticks out with pain or with firmness in this area. And if we do find some firm spots, we can just lighten up even our touch more and make the circles the very calming motions. Then you go into your armpit. To be honest, if you are addressing your head, which has 1/3 of your lymph nodes, right? Your head comparing to the body, and 1/3 is here because probably the brain, very important object, is there. However, when you do the head, you don't really need to go to the armpits, but because we really want to drain and we don't want to have any stuckness there, we can address armpits. But it would not be a mistake if from here you go up to the neck, because your head flows right here and then it's getting on the stuff. She cannot rise her forehead. So we're gonna rise one time for this lady, my forehead, and then we're gonna block her, right? You seen it? Goodbye. Oh, sometimes the comments are really annoying. Let's go to the side of the neck. Okay. And we're gonna go after the side of the neck. I want you also pay attention at the beginning of your sternocleidomastoid. That's an area with, first of all, that's where the muscle becomes your tendon, and this is the area where is a lot of stuckness, a lot of gluiness, a lot of dryness of your tissue, and obviously this is going to be deforming your under jaw look and your jawline. And you would say, okay, but you promised eyes. Well, we are opening the passes, right? We don't want to create any dump on the pass from our eyes. Our eyes drains like this and inside. So it will be important to also address the back of the neck. But we continue with underjaw. Now I lost all of the comments. I can frown, guys. It's not the thing. What can I do with my face? The thing. What can I show you? You can do with your face. Okay. We're gonna block the frown person too. Okay. Now we're going to go to. Now we're gonna go to the side of the face. Just again, lightly tapping. We are not addressing any stuckness yet. Is it safe in pregnancy? Sonia, my love, pregnancy is such an interesting time for everybody. It's different journey. This tutorial is safe, probably going somewhere more structural, more like glow based. Not really, because I don't know your particular pregnant journey. Okay, now we're gonna go to the back of the neck. And the back of the neck, whenever you're addressing your eyes, you have to address your back of the neck, because this is like, if I would remove and we would see, this would be a sinus that's gonna go like this inside and then drain to your jugular vein. So even the palpation, not to mention that our back of the neck really connected to our eyes through the suboccipital muscles. They move our head really fast, so it is really important, especially people who has a lot of pressure in their eyes or work a lot of on a computer, is to do and you can be a little bit rougher than you are particularly, like for example on your face. You can be on your back of the neck due to lots of layers of the muscles and lots of fat as well. There you can actually use a moderate amount of pressure. When I say a moderate amount of pressure, we remember that pressure doesn't equal pain. from pain 1 to 7, you stop on 7 anytime, any day, but the pressure, it means go deep and sustain that pressure. I just tried it with you. Yes, we continue. And when you go on the back of the neck, it will naturally make you to go on top of your ear, and you can even include your ear, not only because it's very reflexology based, but it's also the ears in osteopathy world that connects to the whole dura mater, to your brain. So we're going to do this because obviously if you think about your eyes and like the drainage is happening inside of your skull. So obviously you want to make sure that your brain gets a lot of drainages, a lot of, there is no any metabolic exchanges extra. I don't use oil right now. We don't need even to use oil right now. We are working with the our scalp and back of the neck. Why would you need to use oil? And we're gonna go a little bit towards the temporalis. So all of this motion like this, like you want to lift your face, yes, that connected to your scalp, surprise, and you want to do it by pulling it from the scalp. By the way, whenever the surgeons do it, they also pull it from here. You know, they just don't cut it here and like pull it here. No, they pull it from there. Very good, very good. A little bit of the scalp. No need to be slow on the scalp, just a little bit increasing the circulation, because when you work, when you want to lift your eyebrows or work with your eyes, scalp is important as increasing circulation to it. Very good time management we have for now. A little bit of the sternocleidomastoid with ear. So what we're gonna do, we're gonna pull your ear and your sternocleidomastoid away from each other. Obviously you're not pulling as you would pull the clothes, you're being very gentle, but the idea that you move your ear towards up and diagonal, and your sternocleidomastoid are down. Your sinuses are draining. Yes, if you feel water, totally normal. Do you inject Botox on your skin? Respectfully, your skin looks very tight. Thank you so much, but you can have your skin tight without injecting Botox. Moreover, think about muscles and think about any tissue and even the lymphatic, and think about the lymphatic doesn't have any pump. Like you have a heart that pumps your blood, but lymphatic doesn't. So the only thing that pumps lymphatic is the literally contraction of your muscle, and with Botox you numb it. So because your muscles don't move, clearly your skin doesn't crease. Ooh, what a win! But your skin doesn't also get enough of blood supply, because again, nothing moves, right? And then we see the dual skin afterwards. We're opening. Very good. If you feel like your hair were oily or dirty, that's a time to clean up your hands, because we're going into the face. I'm just using the cleaner for that kills bacteria with alcohol, but I will give you a minute. With the ears and the sternocleidomastoid, the level of the pressure is to move it, but not to make yourself be in pain, but good amount of pressure. Your hands, guys, are not super, your fingers, okay? Let's good it like this. Your fingers are not so strong. When you think like, oh, I am strong, I can press. Trust me, you can press comfortably with your body, right? When you lean and stuff like this. But your finger press, like if you would put a weight and press with your finger in this position, it's very little. It's like unless you exercise for your fingers, most likely your fingers are not as strong, to be honest. By the way, the grip is very important for the health in general. Everybody clean their hands. I can continue, say yes, clean hands is ready. Thank you so much. Mom, whenever I do facial massage, my nose started running. This is great. Your sinuses are open up. This is great. Whenever it's, imagine if it doesn't run, it stays inside. And when it stays inside, you know what's the difference between like the lake that doesn't have an access to the other rivers and the ocean. Ocean always cleaner because it always, you know, the flows, the garbage, it always moves. The lake, the one that doesn't have an access, eventually the water gets dirty. So think about that sinuses water that you would like to keep. Is it okay if we have mineral sunscreen on our face? Yes, I often don't remove my sunscreen. Like, you know, sometimes I do massages but it's me. I'm not acne prone. So what we're going to do right now, we're gonna go along our gland to make sure that there is no blockages and along our masseter again to open the passes for our eyes. You're gonna find your zygomatic arch right here, and you're gonna see how easy is the tissue, very soft. So when you pinch on your skin, right, there's a pinching technique, very famous techniques. You don't pinch like this, you pinch more horizontal, and you looking at you taking the tissue away from the bone. Good, because the tissue wants to get to the bone. That's like where it's supposed to, you know, the compression goes. You think, oh, my skin sucks, but no, the tissue actually sticks to the bone, and the skin, because the volume is lost underneath, the skin sucks. So you want to pull it very gently. We are not working on the cheek, we are working on the side of the face. So if you need to know exactly where you're working, clench your teeth, you will feel your masseter contracting. And can massages help with changes in the bone? Yes, absolutely. If you activate the electric effect, which will stop osteoclasts ruining your bone and activate your osteoblasts. So when you take that fold, when you take, I don't know the better word is sausage. If somebody comes up with a more demure word of saying this, but this is like a sausage, and see that this sausage is all equal. Because sometimes you take it and here you feel like a fat, and here empty, and here is like, you know, neutral. So this is we want to make all our face like that tight effect is when you are people say roll. Yeah, roll is good. Skin fold, yes, but sausage is, you know, and the sausage has to be perfect size. So we're looking for that. And if you feel like, you know, here is a little smaller, we kind of mark it a little bit to become softer and equal. And then you go lower, and again checking. You can drop your head. I suggest you drop your head so your tissue falls into your hand and you work it. And you don't even have to roll your roll, you can just repurchase and take another fold and go. And then just be mindful on this side. And then with your thumb, you're gonna go underneath your ankle here, right here. We will touch a little bit our medial pterygoid right now from the inside, just a little bit. See how much is your tissue letting you go without pushing it, but work on it like this. And then open your mouth, hold your ear, and go slowly to unclench your jaw. Please do not do it here. And after already this, you can go back to your medial pterygoid right here, so under, not inside, we're going right under. And seeing if there is any tense spots that we can release. Very good. Now second side. I save this live and send it to people who is on the wait list. Why does my foot pain? Nerve endings? Is it dangerous to touch a nerve while doing face massage? No, it's not dangerous to touch it. You will feel it, like you will feel like electroshock. But nerves are very skinny. I don't even know. You know the headphones, like like this is the size of the nerve, and this is a thick one. Like if you think about it. So if you feel like something weird, you just move literally a little bit, and you're not gonna touch the nerve. But you are touching your nerve when you sit on your bump. Yeah, you are compressing your nerve, and all is good, right? Because nerves are first of all they're like in a fascial sheet, and secondly our body thought of it. Our creator thought of it. So you can. That's not the the goal. It's not the goal to touch your nerve, but anytime you touch, you already touching your superficial nerves and lymphatic system. So it differs with this. Oh my god, with another side. Yes, great. Now towards here, towards the corner. See which one is more painful. For me, it's this side because I'm chewing on this side much more. One more time of the sausage. This is very important. I see even young girls having already a wrinkle here, and that's like totally a shortness of the masseter, and that comes with the jaw pain. Sometimes it comes definitely with like lots of things on your face, but this area is undertreated, I think. Can you do this if you have jaw problems? I don't know your jaw problems, but myofascial massages are recommended for the patients with a TMJ. Here, but again, consult because everybody's jaw problem is different, but you can always start slow and build up your rhythm. Very good. Now we're gonna go to in here to this area. You guys holding the tissue, so pre-tensioning or like opening, stabilizing, and finding where is the cheekbone. And when you're gonna find the cheekbone, you're gonna find like this type of bone thing. Like you will see that the bone has like a curve, and I want you to think, imagine, intentionally go under that curve. It's usually has a lot of pain. This is where your temporalis goes, and this is the area that we need to release. So you go slow, you're not pressing with your finger, you kind of let your hand go under, and you massage here. You massage almost underneath. Don't worry if you get something like this, because cheeks are full of fluid. But we working with the upper cheek. Yes, in my course you have lymphatic massages, of course. Go, and then you go right under and up to the ear. Very good. Now it will be easier to address your temporalis after this. So slowly find that spot that will be easier for you to reach, the under the bone, and massage. 10-12 circles are enough. And a little. Now we're going to do the roll of your temples. But first let's prepare the tissue before the rolling. And now we're just going to move, opening up this, like you were like this, and then you open it up and it goes all the way. So you hold in here and go. You hold in, so you start with your temple pretty deep and then you go more superficial. Are you actually live? I am actually live. What do you mean? Okay, right on top of your ear, like really move everything towards the side. So you start with quite deep and then you like an animal that goes under the sand and then travels under. Oh my god, immediate difference, yes. Great. Oh, super good. How is everybody feeling? It has defined my jaw. Great. I think that was about the program. I read a little bit of the comments, and some of the comments I can't read. Now we're gonna go to the under eye, and especially the point where is your eye muscle meets your levator muscle and creates almost the connective tie. Amazing, amazing. Everybody's feeling amazing. We're going to hold the tissue. You holding, you lifting, and you kind of even moving it towards the side. So not like you're trying to move your, not like this, but like just a little bit. And you put your finger right where, not where is your soft, but where is the orbit. Kind of the right here. So we're not going into the orbit itself, we're going under the orbit. So pre-tense, this is important because doing something like this is good for nothing, but if you pre-tense and you slowly, especially girls who have a tear throw, like very defined line here, I want you to pre-tense, really like put your eyes on your finger and see when you pre-tense and when you start massaging it, does it feels like a wire? Like, does it feels like inside of the tissue it's gonna feel like a wire for people who has already inside. So it will be somewhere here. It will be like tissue, and then like little, very tiny, but like connective type of wire. Like you're looking for the 10 size smaller, thinner here. The more the less it hurts. Tissue holds lactic acid, glucose, so you have to break it up. Yeah. Okay, look here. We need to open in this this area. And just you soften it by moving it slow. Some ticking sound. Right here, and then you move a little bit lower and do the same, because this is where it's gonna be. It's gonna be somewhere here. Especially here, because there is another muscle that comes here and makes this area shortest. Let me not only delete that person, let me, how I remove that person. I don't know. No, I need to learn how to block people on YouTube now. God help me. Okay, here. Continue, but it is important pre-open it. You will see maybe immediately, especially girls with like a puffy eyes, might see a little puffiness, but 30-40 minutes it's gonna remove and the new blood gonna comes in, and this is the area where it's like really very little circulation compared to the rest of our face, and it will will make your under eyes skin better as well. Now on the second side again. Yeah, I do live on YouTube, so there is nice people there, but you can see there are some people who it should be on without internet. Wow, I can breathe easier now, of course. But I want you to tell me if you feel it, guys. Not just you massaging with like, okay, but look, imagine you have your eye muscle right there, and there is another muscle, and these fibers of the eye muscle, due to the low circulation, are they changing into more connective tissue type of muscle. To block people, you click on their profile and it will say block, I think. Oh, thank you so much. Thank you so much. Thank you. Let me see if I can. No, it says like put a user in timeout. No, I want to cancel the user. I'm going to put the... Oh, why YouTube can put only users in timeout for 24 hours? I want to block them permanently. I feel it. Okay, great. Okay, I feel something here. Hello. And you know, a lot of people like oil, cream. I'm currently in need on removing my sebum. Why? Because when it's oily, all tissue travels together, right? I cannot open up the tissue, right? I like with oil, it's like goes already to the other house, you know. Here I need to open up in order to go deep. Massage, very good. Had to block a person again and again. Now we're going to go into the eye ligaments. Oh my god, so many people don't ever address them, but they're like actually holding your eye. So it's right here. What you're going to do, you're going to find it first. It's going to be right here. So what you're going to do, nicely open up this side and massage in here, right where it's like the middle of your eye. Massage, and then nicely open up, and then have your hands like this and go. And again, the idea that you're almost pushing your eye down, but with this hand, but you go all the way right here. And now place your finger here and close your eyes like hard. You will feel where the impulse goes. Impulse usually goes somewhere here, and we're going to relax this area as well now by working on the orbit. So you're not stretching anything, you're working on the orbit. You tick and you're working on the orbit. Up. Very, very small move. you will feel how much tension your eye, the lateral part of your eye have. And again, you can just close your eyes and you will see that impulse that eye has. So right here, just a little bit. Even if you put your hands like this on the bone, you're already there. Glow has 20 to 30, 35 minutes tutorials, maybe a little bit even more advanced than this, but yes, this is this is a little taste of what we do in Glow, of course. Now again, this another time, use the little finger. Massage, and when you massage this area, try to close your eyes. See how much your eye movement is pulling your muscle. You can ask the question, one-on-one question in Glow. You can definitely send the video. And here this very slowly, like basically not moving on the skin, more thinking of the underneath layers. Yes, very good. Open it up. Now we're gonna go to the middle of the face, but let's in case if some people have puffy lids, they can place a little bit of cream on below their eyebrow, and we will do a little drainage. Just a little bit, and just nice circular slow motions like this, barely touching. Protect a little bit of your eye so you don't really move it, and then barely touching, this type of flow. And move it like this, flows like this. A little bit more on your fingers. Now we're gonna go a little bit firmer because we want also to create a lift. So now when you touch it, so we remove the fluid, now we're gonna lift your eyebrow. Now with the circles, we're gonna use the strongest thumb, and we're gonna be lifting our eyebrow. So you pre-hold all of the side, and you lifting like this, like you're trying to create space in between your eyelid and the eyebrow, but you're focusing more on your eyebrow, like you're trying to make your lower hair of your eyebrow go higher. Especially interested in the first third. Relax your shoulders. Remember, if you have a table, you can just put your elbows and hang on your table, hang your head. You're so strong working through this, distracting, sometimes mean comments inspiring. Yes, Maria, and I have TikTok and I have YouTube, and I'm like, what happened? What happened to people? Like, no more live massages, I guess. Like this, lift. So first, just let's do nice I think we did nice here, yeah. But this is my more puffier eyelid, so I do extra. And the hair tick. And move. Here we have our little depressor supercilii. It's one also strong muscle, and you can even go on top of your eyebrow and then smash it. This eyelid massage is insane, instant effect. Yep. It somehow gets good views when it gets rude comments. Yes, guys, that's another thing, right? It's never gonna be a lot of views with not people that, you know, don't like me or don't like what I do or think whatever. So let's get back to the that lower part. We're going to put a little bit of cream on the side, just a little bit, just to have your just slightly, and we're gonna move like this, like 1, 2, 3, 4. You're gonna love this. 1, 3. One. Very little traveling, right? People, no, we're not doing this. We just opening this. How do you deal with competition? Because I don't have competition. Very good. How do your eyes look after everything what we've done, especially on the under eye area? People who had the tear through, people who had a bigger under eye bag, they already should see subtle results. Now we're gonna go to the zygomatic arch with the frame technique. So what you're gonna do, you're gonna frame your zygomatic arch like this, but you're not gonna frame from here, you're gonna frame side by side. So starting here, then here, and then here. This is already deeper. This is already like we actually sliding, we have a little cream. Yes, that's what my therapist says. That their comments is not about you, it's about them. Look at this. Look at this. Like, didn't even touch his eyebrow, just gave a good release for this zone, and those zones are like, ooh, moved apart. Crazy. Crazy. Again, starting from this point, then this, and then this. And tell me truth. Tell me truth. When you even slide, because I let you use the cream, right? When you slide with the cream on top of your zygomatic arch, especially right here in this zone, do you feel a tender spots? Because I do. Then we're gonna go here again, 2 fingers, frame technique. Frame, lift, move, glide. Yes, people feel, yep. It's very tender, usually very tender and puffy. And then you see girls, here is a puffy, here is loss of fat, and it looks like bigger loss of fat because here is puffy. You know, it's like looking from the heel somewhere. When this is more smooth, and it's not gonna be perfect smooth. We are not dolls, right? But when it doesn't have that, like, you know, that, like, I don't know how you say it, like a heel, a heel on your face, it doesn't look like a hole here. That's it's a visual effect of the shadows that a lot of like a good plastic surgeons understand, that it's actually about how the shadow hits your face. That's how younger you look. Okay, it feels so wonderful. Oh my god, very good. I'm very happy, guys. Now a little bit of framing your eyebrow. Here again, probably remove excessive if you feel like, because I'm already feeling that all my skin gives the sebum, and that's normal reaction, right? Basically your own oil. So if you feel like you're too slickery, love your program, went through it on a March. Yes, guys, if you would like to participate in the program, today is the last day. We're gonna frame this and we're gonna give all power to our middle finger. So our middle finger is lifting this eyebrow, but this one is going along along the fibers of your corrugator as well. Slow, slow, slow. And you can have the second hand like this, and it's helping it. It's like two brothers that frame that guy, lift that guy, and move that guy away from the glabella zone. Bigger space in the glabella zone is associated with use, with excited emotions when we lift our eyebrow. Very good. Second time, lift and go, 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 go. Already less hollow. Yes, Kaylee, I'm happy. Move, 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 move. Don't strain your neck. Sometimes when we don't feel much with our fingers, we like to press with, you know, like, oh, don't stress your neck, right? The tissue will let you go. As depends on your relationship, guys. If it is your first date, you're not gonna go very deep. You're gonna go superficial, and that's okay. Don't rush it. You know, if it's you're already in relationship with your face for a year, you're gonna go deeper and deeper. So this is, respect that. You know, don't think that just because it's, you know, it's like, you know, you don't associate yourself with your tissue can say no, but your tissue can literally say no. So be very respectful towards it. And if it doesn't want to go, you go slower, you go lighter, and you understand that, you know, the best is yet to come. I can see puffiness draining in my eyelid. Wow, my eyebrows look lifted. So good, guys, so good. I was straining my neck. Yeah, we do. Sometimes I do too. But it's important to take, you know, take a moment, notice it, and relax it. Oops. Limit on my Instagram. Now a little bit of the cream on the between your eyebrows and your forehead. Well, today we might do a little massage for your oh, this is nice. I don't know how you did that heart. So now we're doing already more polishing story. So you put a little bit of cream, and here we're gonna go, but not up, we're gonna go a little diagonal, and wait until one finger goes and then another one goes. So you're still being quiet, deep. And I want you to use this angle. I did that hard? How I did that hard? How it's like this? I don't know how I did that hard. It works, it's consistency, yes. You did the heart with your hands. Okay, I see now. I'm like, where's my heart? Okay, now I see. Okay, lift. Good. Now the eyebrow is going higher and higher. And we're going to the second side. TikTok doesn't give the hearts when it's hard. Now we put it in the middle and we relax our shoulders. This is important. We imagine like our forehead, our tissue of the forehead, you know, it sticks to the bone, but now it's hop and stick to your hand. Imagine it was like it disconnected from your bone and stick to your hand. Imagine, because that will not happen. But you imagine it like you holding all of your forehead on in your fingers, and then once you imagine it, once you really work, and this is a frontal lobe, guys. If there is exercises to imagine, it's definitely when you work on your frontal lobe, and then slowly you move this towards the side and up, but your hands moving towards the side. So again, you kind of connect to the middle and go towards the side, connect to the middle, go towards the side. Now we have to finish with the scalp massage and the hairline massage. I'm gonna brush my hair a little bit. Oh. And let's start with lifting this all the way here. When it's hard here, it's hard to pull like this. It's possible, but it's still hard. So you do like why I have a like the pimple pimple thing, but if somebody has a better comparison, I would love to hear that. And when you do that, you see how here up the line, no, we need to pull the tissue all out and up, all out and up. This area is harder to move. And we're gonna go from here, I'm gonna go from here, lift. Oh. Amazing. I love working with forehead. It's really relaxing. Lift. And now scalp massage. Now before we were more like nice, now we're gonna go a little deeper. Try to take a fold on your scalp, and if the fold is thick enough, like if you can take a fold, a big fold on your scalp, that tells me that you have stagnation on your scalp, guys. Massage. And now we're going to go like this, like this, like this, and imagine our hands like an octopus hands. So you grabbed all of your scalp, but your hands are not just 10 fingers, they're like wrapping all of your scalp. You're not gonna make yourself painful, like this is a comfortable, but on an exhale, for example, you're gonna try to close your fist a little bit, lifting your scalp of aponeurosis away from your bone. And relax. It's hard for the shoulders, but we want that smooth forehead with no wrinkles. You have to do that. Okay, guys, this is all what I have for you. You can look at yourself in the mirror, especially the area around your eyes and the under eyes. I'm gonna answer a couple of the questions. I'm gonna tell you that Glow, my program, the enrollment is closing today. So if you had thoughts of it, today is the last day to join. Don't forget. You're welcome. Thank you so much. Thank you for the live. I've taught so many people for massage techniques. That's amazing. Can we build muscle in the face? You can muscle, when it's tensed, it loses 30% volume. It gets shorter for 30%. So you can untense it, and that's gonna bring it volume. But if you want to be a bigger face, you need to be in a proficit of calories. There is no other way. Whoever says the other way and not mention prophecy of the calories are lying and don't know anything about building the muscles, especially on the face. Like, oh, crazy. Is it getting rid of nose hump possible? No, it's usually the bone, my love. It's either accepted or we're gonna do the surgery. You know, you can't do the hump. It's a bone. Here is a cartilage. You can not go crazy, but you can depuff your cartilage a little bit, make it less puffy by relaxing the side of the nose muscles that make you the nose droop and things like this, but not significantly. My droopy eyelids are gone. This is great. I breathe better, thank you. This is amazing. The live will be sent to the people who is on the wait list. The wait list will be open in a couple days, in a day, and then the lives will be can glow. Can you do glow at any age? Glow can be done after 18. I think that's a great. How or stop the body from retaining water. That's great. If you remove all fibrosis, adhesions, your body will retain less water, but we are living in the real world where it's like stress, sodium intake, cafe, restaurants, something that you can't really control happens. So it's not only important to ask body not to water retain, it's also important to know how to remove that water, because the problem is that water sometimes it's actually good because that water hides your wrinkles, right? It's like a puffy thing that hides your wrinkles, but the bad stuff, it stretches your skin. It stretches your skin, it makes it dull, it makes the toxic environment for your cells, like, no wonder we have a problem with the skin afterwards, like after, the breakage of the face is showing. Can you tell me any suggestions for the droopy lids? Angela, I have so many tutorials and we just did the whole tutorial for them. But droopy eyelids, it has to do a lot with the eyebrow. As soon as your eyebrow gonna be higher, your eyelid will lift. When I do scalp massage, it gives me headache. If it's persistent and you, for example, did it for months and it's consistently give you a headache, that's a good case to go to a doctor and tell him that, because it shouldn't be like that. I would go to the doctor and say, hey, I'm touching a little bit my scalp, and it's, immediately I'm definitely not okay. Do you address the double jaw on the glow program? Absolutely. I would say, if you think and if you look at the progression of the glow girls, first thing that it changes is a head position and your underjaw. That's the first floor to drain, to be honest. It's not like nasolabial folds. The underjaw, you can see 5-7 days. It's just fluid hope, especially if you're young and you don't have a lot of underlying health issues. Can you reduce excess skin? Excess skin, you don't have excess skin, you have a fluid that stretches your skin. You can reduce the fluid, and then skin will tighten with a new blood flow and with the correct techniques that can activate fibroblasts so they can create more elastin and create more collagen. But you don't have excess skin. Your skin is attached to the fat and to the muscles, so it's not like detached extra skin. They put you, they gave you a little extra. That's not. No, you stretched it with loss of like you were rapid weight loss, rapid weight gain. That what stretches the skin. That when you feel like, I have an excess skin. If didn't happen to you, this is the only case probably, when you have excess skin. If this is a rapid weight loss or weight gain didn't happen, you're good. When you're going to have this course again? Well, for now, the enrollment will be closed tomorrow. Actually, today at 12. So for some people tomorrow, but the next course in a month or two. How effective glows for her forehead wrinkles? Super effective. You glow forehead wrinkles. It's your own it's your own project. What do I mean by that? Because forehead wrinkles requires you not to consistently lift your eyebrows. So I can tell you why you might consistently lift your eyebrows, because your head in a wrong position. So every time you need to look at the horizon, your forehead helps you. So we need to put your head in a correct position, relax your scalp, put the occipital frontalis muscle in normal tonus, give the tissue not only blood but also time to regenerate the wrinkles, right? The deeper wrinkles, the longer it goes, and it goes like tuk tuk tuk, layer by layer, it doesn't just disappear. So it's super effective if you know that this is your project, and you are mindful about when you raise your eyebrows. You ask everyone around you, tell you when you raise your eyebrows, when you wrinkle in your forehead, you using the tapes, and you're addressing the whole system in Glow like we do. I don't use retinol. Anastasia, many people say you do Botox. How can you prove them wrong? Well, if they know anything about the Botox, they know that when you have Botox, you definitely cannot do this or this. But you look at after massage, I cannot as deep that. But look at the beginning of the video where I had the super deep ones and where we can prove them. But the thing is, I don't have to prove anything to anybody. People who think that I do Botox is people who never watched any of my videos, because I literally guys, I literally frown on every other video. Like my mom makes fun of me. She's like, stop, this is already like looks like a circus, like who you proving? If people don't believe you, like bye, like what I'm losing nothing. They losing $50,000 and good brain. Plus there are some people that are on Botox, and I truly believe that the studies about Botox travel is correct. So maybe the cognitives, it's like maybe they also see some unicorns behind me, and we can't prove them wrong. So I don't care. Yes, no need to prove, right? You agree, especially when I'm consistently doing it. And you can see even after this short 45 minutes, the eyebrows are so high, everything is so into the relaxed state that when even you frown or contract it, it doesn't go as deep. That's how you don't get deep wrinkles. You consistently relax your muscle. Your mother is right. Thank you. Yes, because she's like, stop it. She's like, stop doing this. She's like, you're not like, you should not be like this. And I'm like, well, but I want to tell them, and like, look. She's like, don't bother, I'm like, yes, Froni's opinion, good. I like Froni's. I've tried tapes, Froni's. I've tried the silicone patches. I think for everybody is different, honestly. Cannot say that one is bad and other is like silicone patches are questionable. Because why they are questionable? Because they don't really prevent the movement. They just create a vacuum, whereas your derma literally, like I don't know if you ever tried to grow your own tomatoes in a cold country, and you create the plastic thing for the tomatoes to think it's warm, and inside is like everything is like gross. You create that humidity. So that's very similar, but it doesn't, you think about literal problem. The problem is that the skin folds when the muscle contracts, not because you just need to plump up your derma, temporarily plump up your derma. So guys, I am very taking this very seriously. Anything for tears, or you just missed amazing tutorial for that. Okay, do I use vitamin C cream? Vitamin C I do use, and here I bite on my lip, because people will say something. I bite yesterday on my lip. It was very good dinner. Thank you guys so much. Today is the last day to join Glow. I've just realized that September 16, it's 100 days till the new year. So like literally this is the best time to start in September your transformation. Before new year you will see a huge difference of the like your summer, and how you're gonna see that's going to be enough of time to create like a wow difference, you know, as some of my followers saying that, you know, they have to switch their ID because they look really quite different, and not only in terms of being more lifted and sculpted, but also in terms of having more life in your eyes and be more relaxed and look at this world a little bit differently. Thank you, you're amazing. Thank you guys, you're amazing too. I will see you soon. I will be posting an amazing tutorials coming up soon, so don't forget to like and repost, share, and everybody who is joining the glow, congratulations for your new start. This is a really transformative program. And bye bye. Closing.